I'm Katherine O'Sullivan. I am Head of Secure Data Services at the University of Sheffield. I'm also Associate Director of the Yorkshire and Humber NHS Secure Data Environment. I'm also Principal Investigator of the PANORAMA Early Adopter Project. We've been meeting as a wide project team for the TREvolution program. TREvolution is a core program of organizations that are developing tools and processes to help improve researcher access to data. As one of the early adopter projects, I've come in sort of after the main project is met to meet with the projects to help them deliver the tools that they are developing. So we are providing the testbed environments to have those tools be operational in trusted research environments and secure data environments. We are here today to launch this activity and to kind of showcase the incredible work that's already been done and the work that we'll be doing over the next year. The PANORAMA project is a pan-North collaboration. It is a collaboration of secure data environments and university-based infrastructure that covers the whole of the north of England. So it's a population of 15 million individuals. And our project is very much about making researcher access to data safe, secure, but most importantly, faster than it traditionally has been. And we're doing this by taking a federated approach amongst the partners. What we mean by that is we are coming together to formally work out processes and tools and ways of working that between our organizations streamline things like information governance, ethics processes, the way in which that we process and make data available for researchers, and then the way that we make data more streamlined in terms of leaving the secure environment so researchers can publish their impacts much faster. Our Pan-North collaboration is partners between the University of Sheffield, which is a delivery provider of one of the NHS England secure data environments. It is a partnership between the Yorkshire and Humber Secure Data NHS Secure Data Environment, the Northeast North Cumbria Secure Data Environment, and the Northwest Secure Data Environment. So we have specialists that develop infrastructure, policies, procedures, but also clinical staff and patient and public involvement across the whole of the region. Our goal is to truly create a functioning federation so that researchers have access to data of more than 15 million individuals. We plan to do that by keeping kind of data in the locations that it's currently in, but we aim to streamline ethics applications and information governance processes so that researchers can apply quicker and easier to get access to that data to do research in the public benefit. We aim to deploy tools that will help us merge data or allow researchers to write analytical code to across the different environments so that the data stays in situ, but they are able to actually run analytical queries against that data. And then again, we're looking to streamline all of our processes and tooling that helps us release the analysis that researchers have done safely, securely, but much more rapidly than doing things in a manual, disjointed way. Research has traditionally in the UK focused on very, very small pockets of data. So it will be very regional focused. It will be small populations, and oftentimes it will be very limited types of data and data that can't be linked between, for instance, health and social care, or health and economics, or health and environment. So our project, by the end of it, should have a transformative model of working across different organizations that do all of this work and keep data safely and securely and make data available for research. We should, by the end of this project, have a completely streamlined process for researchers to apply for that data, access the data, and then be able to publish their results safely, securely, and most importantly, rapidly. We need to be responding to health inequalities, other kind of research needs in a rapid way that can improve the lives of people right now, not 10 years from now. All of this we are doing with an approach to patient, public, and professional engagement. So we're looking at 3 different audiences. So patients, specifically because we hold quite a substantial amount of health data, we want to talk to patients so that we get the understanding of how patients feel about this. The public has much, when we want to talk about linking data between different sectors such as health and environment, we need the wider public's view about how we do this and how we facilitate research. And we're also doing engagement with professionals. So organizations each have to manage their data in their specific way. And we want to work with professionals to help them understand how we can do this safely and securely, where there isn't going to be a risk of any kind of data security. So that way, people's data stays safe and is fully confidential, but researchers are able to make life-changing impacts on society.